please, those who can come and add some days of weeks or months or years life in the world. Thank you.
Kapat okay? Kapat हाँ को बसीजा हाँ ना गई है इधर तो कहीं पर कुछ खबर हाँ
हमने वाले मोहम्मद सलवात أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم تبارك الذي بيده الملك وهو على كل شيء قدير الذي خلق الموت والحياة ليبلوكم أيكم أحسن عملا وهو العزيز الغفور الذي خلق 7 سماوات طباقا ما ترى في خلق الرحمن من تفاوت فارجع البصر هل ترى من فتور ثم ارجع البصر كرتين ينقلب إليك البصر خاسئا وهو حسير ولقد زينا السماء الدنيا بمصابيح وجعلناها رجوما للشياطين وأعتدنا لهم عذاب السعير وللذين كفروا بربهم عذاب جهنم وبئس المصير إذا ألقوا فيها سمعوا لها شهيقا وهي تفور تكاد تميز من الغيظ كلما ألقي فيها فوج سألهم خزنتها ألم يأتكم نذير قالوا بلى قد جاءنا نذير فكذبنا وقلنا ما نزل الله من شيء إن أنتم إلا في ضلال كبير وقالوا لو كنا نسمع أو نعقل ما كنا في أصحاب السعير فاعترفوا بذنبهم فسحقا لأصحاب السعير إن الذين يخشون ربهم بالغيب لهم مغفرة وأجر كبير وأسروا قولكم أو اجهروا به إنه عليم بذات الصدور ألا يعلم من خلق وهو اللطيف الخبير هو الذي جعل لكم الأرض ذلولا فامشوا في مناكبها وكلوا من رزقه وإليه النشور أأمنتم من في السماء يخسف بكم الأرض فإذا هي تمور أم أمنتم من في السماء أن يرسل عليكم حاسبا فستعلمون كيف نذير ولقد كذب الذين من قبلهم فكيف كان نكير أولم يروا إلى الطير فوقهم صافات ويقبضن ما يمسكهن إلا الرحمن إنه بكل شيء بصير أمن هذا الذي هو جند لكم ينصركم من دون الرحمن إن الكافرون إلا في غرور أمن هذا الذي يرزقكم إن أمسك رزقه بل لجوا في عتو ونفور أفمن يمشي مكبا على وجهه أهدى أم من يمشي سويا على صراط مستقيم قل هو الذي أنشأكم وجعل لكم السمع والأبصار والأفئدة قليلا ما تشكرون قل هو الذي ذرأكم في الأرض وإليه تحشرون صدق الله العلي العظيم بسم الله الرحمن الرحيم. This is Surah Mulk. I recited the first 24 ayah. Bismillahir Rahmanir Rahim. Blessed is he in whose hands is all sovereignty, and he has power over all things. He who created death and life, that he may test you to see which of you is best in conduct, and he is the Almighty, the All-Forgiving. He created 7 heavens. He created 7 heavens in layers. You do not see any discordance in the creation of the All-Beneficent. Look again. Do you see any flaw? Look again once more. Your look will return to you humbled and weary. We have certainly adorned the lowest heaven with lamps and made them the means of pelting missiles against the devils, and we have prepared for them a punishment of the blaze. For those who defy their Lord is the punishment of hell, and it is an evil destination. When they are thrown in it, they hear it blaring as it seethes, almost exploding with rage. Whenever a group is thrown in it, its keepers will ask them, "Did not any warner come to you?" They will say, "Yes, a warner did come to us." But we impugn him and said, "Allah did not send down anything. You are only in great error." And they will say, "Had we listened or applied reason, we would not have been among inmates of the blaze." Thus they will admit their sin. So away with the inmates of the blaze. Indeed, for those who fear their Lord in secret, there will be forgiveness and a great reward. Speak secretly or do so openly. Indeed, He knows well what is in the breast. Would He who has created not know? And He is the all-attentive, the all-aware. It is He who made the earth tractable for you. So walk on His flanks and eat of His provision, and towards Him is the resurrection. Are you secure that He who is in the sky will not make the earth swallow you while it quakes? Are you secure that He who is in the sky will not unleash upon you a rain of stones? Soon you will know how my warning has been. Certainly those who were before them had impugned my apostles, but then how was my rebuttal? Have they not regarded the birds about them spreading and closing their wings? No one sustains them except the All-Beneficent. Indeed, He watches all things. Who is it that is your host, who may help you besides the All-Beneficent? The faithless only dwell in delusion. Who is it that may provide for you if He withholds His provision? Indeed, they persist in defiance and aversion. Is he who walks prone on his face better guided, or he who walks upright on a straight path? Say, it is He who created you and made for you hearing, eyesight, and hearts. Little do you thank. Say, it is He who created you on the earth, and towards Him you will be mustered. Sadaqallahu al-Aliyyul Azim.
أعوذ بالله من الشيطان اللعين الرجيم بسم الله الرحمن الرحيم والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر وفوضوا أمري إلى الله إن الله بصير بالعباد. I entrust my affairs to Allah subhanahu wa ta'ala. Verily, He looks after His servants. Respected elders and my brothers, Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome. प्रथम तो शुरू करूँ चु अल्लाह ना नाम थी जे महान दयारू अने दयार करनार छे एक बनो अने नेक बनो. Hadith merits of tasbih of Hazrat Fatima Zahra salamullahi alayhi salam. Allahumma salli ala Muhammadin wa ali Muhammad. Imam Muhammad Baqir alayhi salam said, Allah is not worshipped by anything more meritorious than the tasbih of Fatima Zahra salamullahi alayhi salam. Had there been any worship superior to it. Most surely the Holy Prophet sallallahu alaihi wasallam would have granted it to Janab Fatima salamullahi alayhi salam. Wasail Ushia, Volume 4, page 1024. Salawat of Sayyidah Fatima al-Zahra salamullahi alayhi salam. Allahumma salli ala Fatima wa abiha wa ba'liha wa baniha وسر المستودع فيها عدد ما أحاط به الملك. O Allah, send blessings on Fatima and her father, her husband, and her sons, and by the secret installed in her, which only is in your knowledge. Announcements for today, Wednesday, the 20th of November, 2024. Please switch your mobiles to a silent mode. Please keep your belongings with you all the time. Please cut waste, cut costs, and save the planet. Please note there is a levy of £1 for the use of Jamaat cutlery each time. Guests and visitors are exempted, so please remember to bring your own cutlery every week. We also have a reusable cutlery for sale at £2 if you wish to buy or donate towards the fund Hassan. Anyone wishing to sponsor a full or part niyaz for the sawab of marhumeens, please contact any committee member. The cost of full niyaz is £1,200. I'm pleased to announce that Hujjat seniors are hosting the Ladies of Light celebrations for the wiladat of Bibi Fatima alayhi salam. Allahumma salli ala Muhammadin wa ali Muhammad. And Sayyidah Zainab alayhi salam. Allahumma salli ala Muhammadin wa ali Muhammad. This will be held at Harefield on Sunday, the 15th of December 2024 at 10 a.m. to 2 p.m. All Hujjat senior members and 70 plus non-members are invited. Please register with Nur Ali Bhai Nasser at the desk or contact him by phone or WhatsApp. By the way, it's for free and any donations will be appreciated. Our guest speaker today is Dr. Munsif Bhimani, all the way from London, Ontario, Canada. I'm delighted to welcome him to address us. Please recite and welcome him with a loud salawat. Allahumma salli ala Muhammadin wa ali. Ahsan.
أعوذ بالله من الشيطان اللعين الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيد المرسلين محمد وآل محمد صل على محمد رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي آمنا بالله وصدق الله العلي العظيم اللهم صل على محمد وآل محمد. Thank you very much for the introduction. It is an honor to be here today and to speak to my elders. And with that, my elders, brothers, any sisters listening to us, scholars, Assalamu alaikum wa rahmatullahi wa barakatuh. I don't know if we can switch to the PowerPoint. So the topic that I would like to discuss with you today is surrounding the issue of falls, which is a big topic, and it is a topic that probably I will not be able to cover all the facets of the topic in the time that I have been allocated. This is a huge topic. When we teach these topics to the junior consultants, it takes several days to cover the topic of falls. I see a lot of falls. By profession, I specialize in the emergency department, what you call A&E. We call it ER, emergency room, but it's not a room, it's a big department. And falls is a big part of our practice. We see a lot of elders with falls. Some of them are preventable, some of them are not. And the causes are so many. The treatments cover so many different areas. And so today we will just be covering the surface of this topic. And inshallah, we'll have some time for questions. We will look at a little bit of the statistics, causes, prevention, some of the injuries to be aware of, investigations, the future of this area, some knowledge points, and then maybe we will have a summary at the end, depending on how time goes. A lot of this data is from Canada. And I will ask my seniors, my elders, a question. How many of you have experienced a fall? Has any of you experienced a fall? At least one of us, maybe two or three, have experienced five of you have experienced a fall. Of those, have anybody of those 5 people sustained a serious injury, a fracture, or anything like that? You have sustained a fracture from a fall. So falls cause a lot of hospitalizations. 85% of hospitalizations in the seniors are from falls. 95% of hip fractures are from falls. And over 1/3 of seniors who are transferred to a home or long-term care is because of a fall. So a fall could lead to a senior individual losing their independence and going into the nursing home or long-term care home. Hospitalizations can be for 10 days or longer in the setting of a fall. So the impact to our healthcare system is huge from a fall. Now, when we work in the A&E, typically we work between 8 to 10-hour shifts. And in our hospital, there are 9 shifts in one day. So, different shifts that start different times, 8 a.m., 10 a.m., 4 p.m., 3 p.m. And they go for several hours. And during one shift, an individual doctor usually sees about 3 to 4 patients who have sustained a fall. Typically, they are seniors, and they have sustained a fall. This is about 3 to 4 cases of the 20 or so patients we see on a shift. That's almost close to about 1/5 of the patients seen on a doctor's shift in the emergency department is secondary to a fall in an older individual. So you can understand how common this is and what the impact is on our system. So why do elderly people fall? And in our sphere, we divide the falls into 2 big areas, 2 big categories: mechanical causes and medical causes. Mechanical causes of falls are often preventable because they relate to environmental factors, structural factors, housing design, footwear, things around the house, carpets, ledges. I notice here in UK, when people have built the homes and you're leaving the house, there's usually a ledge, a raised ledge, as you are exiting. And this is a problem, because when you are not used to that ledge being there, like we in Canada, we have a flat exit. We don't have a ledge at the door when we're leaving the home. If you're not used to it, you can easily trip. And when you trip on the outside, you will fall right away. These are environmental causes. A big environmental factor is weather. In Canada, we have sleet and ice, and I think here too we've seen some in the last couple days, usually in the early morning. And it is very easy to fall on that if you are not wearing the right footwear as you exit. So these are mechanical factors, environmental factors, structural factors, and how housing is designed. And these are oftentimes preventable just by being aware of what is in your environment, what is in your surrounding, what is in your house. Staircases sometimes, the way they are designed, I see here in UK they're very steep staircases and very narrow staircases sometimes. And that is a problem sometimes, because if you have a little bit of dizziness or you have a little bit of what is called vertigo, which we will talk about, it creates a problem for falls. So it's very important to survey the environment that you are living in, your home, the shoes that you're wearing, the carpet. There are many end pieces of carpets and rugs. Sometimes you go to homes and there's many rugs. On top of one rug, there's another rug, right? And this can be a problem for our elder people, because one little slip and you will fall or trip on that carpet. So it's important to survey the environment and be aware of what we call mechanical causes of falls. Now, medical causes sometimes, you know, we have to think about all the medical things that can happen as we get older, the changes of aging, the medications, the cardiac issues, neurological issues, so strokes and Parkinson's and all these things contribute to falls. Nutritional causes and sarcopenia. Sarcopenia basically means that as we get older, we start to lose muscle. And because we lose that muscle, we have difficulty with our walking mechanisms. Our gait stability starts to deteriorate because of muscle loss. And we have to be aware of the fact that as we are aging, we are losing the muscles in the legs. One of the big causes of that is sarcopenia. The muscles start to deteriorate because of a lack of protein in the diet. And so we have to be aware that we have to keep up with the intake of protein in our diet to support our muscles. So that includes muscular causes, and then, of course, endocrine causes, which include things like sugar and different electrolytes, calcium, sodium, those kind of things can change and can affect our balance. Ophthalmic causes, of course, the eyes and how your vision is, can also impact on the falls. So it's very important to be aware of the mechanical causes as well as the medical causes, and to be constantly checking these things. What are the sugars? What are the cardiovascular indices? What are the neurological things going on in the body? And we'll talk a little bit about how we can check these things and be aware of any cardiovascular problems that are starting, any muscle problems that are starting, checking the legs. So those are the medical things, and then before that we talked about the mechanical causes, which involves, you know, an environmental survey. I want to spend some time talking about medications. How many of us take medications? Everybody. I'm also on medication because they say my blood pressure is high. Now I don't know, does it look like my blood pressure is high? I don't know. That's what the doctors tell me, so I don't argue with doctors. So medications cause many of the falls in the elderly, right? And you have to be aware that when doctor puts you on medication, right away there is a risk of falling. When I started to take these blood pressure medications, the first thing I noticed was dizziness, right? And so you have to be able to control that dizziness, because the way that these blood pressure medicines work is that they eliminate certain things in your blood, like sodium and potassium, which increase your blood pressure, right? Because sodium is how the pressure in the blood is controlled. So by eliminating a little bit of sodium, sometimes these blood pressure medications lower the blood pressure. Other blood pressure medications are called beta blockers. They reduce the blood pressure by reducing the stress on the heart and the rate of the heart. But by doing that, they contribute to dizziness. So when doctors put you on these medications, you have to be very much aware that as soon as you start some of these medications, your risk of falling is going to go up. And according to some studies, by up to 30%. The other thing is the whole concept of polypharmacy. So polypharmacy means, okay, I've given you one blood pressure medicine. Oh, blood pressure is still high, give you the second one. Oh, it's still high, give you the third one. Oh, now cholesterol is high. Oh, let's add the fourth one. Oh, now you have a little bit of sleep issue. Let's add the fifth one. Now let us think about this. You're adding one that's causing dizziness. Now you're adding another one that's causing visual problems. Now you're adding the one for sleeping, which is going to make you sedated. So this concept is what now they call polypharmacy. And if you talk to internal medicine, which is the specialists that deal with these issues, when they see an older individual, the first thing they will do, take away all the medications. Who started this? Your GP. Who started this? Emergency doctor. Who started this? I went to drop-in clinic. First of all, let us reduce the list, then we will talk. So if you've ever seen those internal medicine guys, they will, and girls, okay, we have to be careful now. When you see the internal medicine consultants, they will say, stop all these medications, let us try to find a fewer number of drugs that control the symptoms. So medications are a big part of falls, and here we have a list of those medications. Blood pressure medication. So if you look at the odds ratio, what that means is that the higher the odds ratio, the increased risk of those medications causing falls. And you can see that the biggest ones are the antidepressants, the benzodiazepines, which they will give you to help you sleep, because you will go to the doctor and say, Nindar nati aati. And doctor will say, stop eating my head, take Valium, right? But the first thing that will happen with Valium is you will be sleepy in the morning, you will be climbing the stairs and you will fall. So these medications are not good as you get older, and we have to think about seeing the correct doctors to get rid of some of those medications and to insist that we tell our physicians, please don't give me medications without talking to my specialist. Don't give me medications without talking to my GP. I want these medications supervised by one consultant as opposed to different doctors giving you different things. It's a big problem. The other thing I'll mention is as we age, our pharmacokinetics change. So what's pharmacokinetics? Is how the medicine behaves once it's in your body. When you are 35 years old and you have high blood pressure, the same medication they give you, if you are my age, 53, it will behave very differently when it enters the body, and the reasons are there because of gastric pH, gastric motility, all these things that pharmacists study. They know this, and yet you will see that this is often not corrected. There has to be a dose reduction in many medications as we get older, or at least a reevaluation of the dose. So medications are a big cause of falls, and it's very important that if you are going on additional medications to be aware of that, because many of those medications cause falls. Coming to injuries, as you can see, the injuries we categorize into 4 groups. Fractures, and many of you may have fallen and or know somebody that has fallen and had a hip fracture. This is very common. This is very common. When you fall, you get a hip fracture, and sometimes they don't operate for some time because the surgeons are busy or they can't find the orthopedic guy, so you're sitting in ER. Every hour that you waste before you fix that hip is increasing the risk of that person dying. Not just losing independence, not just losing their ability to walk, but there is actual correlation between delayed hip surgery and death. So if you are in that situation and your hip is not being done, ask for transfer to different hospital where there is an orthopedist available to fix that hip. It cannot wait. Even in Canada, sometimes patients come, we see the hip fracture, we call the orthopedist, oh, I'm going to put this on my list for Tuesday. If you say, no, I cannot accept that for my patient. If you're putting this on the list for Tuesday, I need it done tomorrow, I will transfer to a different hospital and contact the orthopedist there. So remember, these fractures can be catastrophic. Rib fractures. Sometimes you fall and you get a rib fracture. Rib fractures increase the risk of pneumonia by 35%. So when you get a fall and you sustain a rib fracture, it is very important to monitor the lungs, to monitor the respiratory function, to do breathing exercises so that the ribs continue to move and the lungs continue to inflate. Spinal fractures. When you fall, sometimes you can fracture your spine, and these are catastrophic as well, because if they are not managed correctly, you could end up paralyzed from a spinal fracture. That's why when you fall, if you have any kind of headache or neck pain, it is very important that you do not move from that position. Call the ambulance. They will come, and the first thing they will do is put a collar on the neck. So the neck is stabilized, because if that neck moves and the fracture piece goes into the spine, that's it, you're paralyzed. So if you're in a situation where you fall and there is neck pain, don't try to get up. Ask somebody with you, your wife, your son, your kids, call 911 or whatever it is here, 999. They will come, and the first thing they will do is they'll put a collar. Very important. So those are a few fractures. Of course, anything can be fractured, especially with osteoporosis, which affects us as we get older. The bones get brittle, right? And so anything can be fractured, but these are some of the important fractures. Bleeds. Bleeds can happen anywhere, but the most catastrophic bleed is in the brain, right? So when we fall, especially if you're taking a blood thinner, it is quite possible that you might have a small bleed in the brain, right? So if there is any kind of head injury following a fall, that requires a visit to the hospital and a CT scan. Skin tears. Many falls result in skin tears and wounds. And as we get older, those wounds do not heal properly, and they can lead to ulcers, they can lead to infections. So if you sustain a fall and there is a tear in the skin, it is very important that that be managed properly with good dressings, with good antibiotics, with good agents so that the skin heals. Do not ignore any kind of wounds or skin tears that might happen. And then you can have solid organ injuries, such as ruptured spleens, such as liver injuries. These are also very common following falls. As we get older, the surrounding structures, the collagen in the skin thins out. That makes the organs more susceptible to injuries when you fall. The most exposed organs are obviously the spleen, the kidneys, and the liver, and any of those can sustain solid organ injuries. You can have a ruptured spleen. So it is very important to assess these things when you've had a fall to make sure that there is no injury to those organs. When you go to the hospital, obviously they will check the ECG to make sure there is no cardiac issues. They will check the vital signs to check the blood pressure. They will do blood work to see if there's been any bleeding, to check the hemoglobin. And likely there will be some imaging depending on what you have injured. So x-rays, ultrasounds, CT scans will be done depending on what has been injured, what is hurting, and then from there it will be determined what additional things are required. This is an ECG, so this is a very common cause of falls. And one of the things that could happen when you fall is that the fall could be caused by what is known as a blackout or a drop attack. You are moving and then all of a sudden something happens, your legs give out, and you have a little spell of blackout and you fall, right? One of the most common reasons for blackouts is cardiac. So it is important to be aware of our cardiovascular health. This ECG is showing a heart block, and you can see that not every wave is led by a heartbeat. So you can see a wave. Normally, when your heart beats, every time there is a wave on the ECG, there should be a heartbeat. And in this case, there isn't. This is a very treatable condition. All it requires is a pacemaker, right? And so it is important that we be aware of this when you've fallen, to be aware of any cardiac issues that could have happened, because sometimes they will not check for this. Sometimes they will not check for an ECG, they will just deal with the injury, and they might not address what caused the fall. So it's important to tell them that I felt my heart rate was a bit irregular, or I felt a little bit of chest pain or shortness of breath, so that this is investigated. A fall should not be just taken as a fall. Sometimes there could have been something cardiac, there could have been something neurological like a mini stroke or a TIA, and sometimes you will have those symptoms as you fall. You may notice certain symptoms. It is very important to convey that to the medical team. Even if you are feeling okay after the fall, you might feel that you have, improved, your condition has been good, nothing is injured, nothing is hurting, and you may not report those symptoms, right? But by doing that, you're putting yourself at risk for this happening again, and the next time it could be more catastrophic. So important, when we have fall, notice the symptoms, convey it to the medical team. If you don't need to see the doctor that same day and you're feeling better, make an appointment for the next day, okay? But if you've had any symptoms and you're worried, then try and get to the hospital and get assessed after a fall, because things like this are very easy to miss. And here are CT scans. These are all CT scans showing bleeds. I'd like you to pay attention to the second scan, where you will see this bleed on the side. That's called an epidural hematoma. And with those kinds of bleeds, so the first and the third scans, you will see the blood is more significant. In the first bleed, you can see the blood, which is the white area there. You can see that it is quite significant. And in the second one, there's actually blood in the center of the brain. In these two situations, there will be symptoms. In the second situation, when the blood is located only on the edge of the skull, there are no symptoms. You may not even feel much of a headache after you fall. And in an epidural hematoma, patients have died because their bleeds continue to expand, and because it is on the edge of the brain, they did not pay attention to any symptoms. So it's very important, if the head has been hit in an elderly patient, current guidelines would say that a CT scan is mandatory. And especially if the patient is taking aspirin or any blood thinner, that would be something to get to the hospital for. You cannot ignore any kind of head injury in a fall as we get older. Typically over the age of 65, Canadian guidelines would say that if the head has been injured at all, even scraped a bit, a CT scan would be mandatory. I don't know about the British guidelines, but in Canada it's very, very clear that anybody over the age of 65 who falls, if they come to the hospital and they don't get a CT scan, the doctor could be in trouble down the road. So it is mandatory we scan all these patients now. So having said that, what are things to check with the doctor? So of course we want to know our strength. The first picture shows the doctor is checking the strength of the patient. So they will check your strength in your arms, your legs, to make sure that there is no loss of strength as we get older, because as we get older, loss of strength can cause falls. Balance. Balance is key. When you go to the doctor, sometimes they will do what's called a Romberg's test. They will make you stand and hold your arms out and close your eyes. And that's how they check the balance. Or they might tell you to take a few steps and see how you're walking. Blood pressure and heart rate. These are often checked at the doctor's office, and I will also mention about this when I talk a little bit about how to check a few things yourself. And then, of course, the senses, which is, the sight and the touch and the hearing, all this will impact on falls. So, things to check yourself. That was what the doctor would check, but, things you can check yourself, starting with the, on the left side of the slide, the environmental scan. We talked about that earlier. What is in your immediate environment that could impact, the risk of falls, the footwear, and any assistive devices if you're using canes or crutches or walkers. Now, when it comes to these assistive devices, even though they are very helpful, they can also be a cause of falls. And I have seen multiple falls because people tripped on the walker, or because people were not holding the crutch properly and their leg got caught in the crutch. So when you use these assistive devices, if it is ever recommended that you use a walker or crutches or a cane, make sure that it is appropriate for your particular problem and that you are using it in a proper way so that it cannot become a cause of falling. Because sometimes something which is supposed to help you can end up harming you, and it goes so for these assistive devices as well. But a few things to check yourself in addition to the environmental scan, the footwear, and checking the assistive devices. One of those things is what's called pronator drift. So pronator drift you can check yourself. Usually it requires somebody to help you, and what you do with that is you hold your arms out like this and you close your eyes, simply like this, and somebody should be monitoring to see if there is one arm that is falling like this as you're holding. And you do that for about 60 seconds, and you ask your son or your daughter or somebody to monitor if there is a change. And if one arm is falling, that is a positive pronator drift sign. And that indicates that there has been some sort of stroke or TIA or mini stroke, which increases your risk of falling. The other thing is postural blood pressure. So when we check blood pressure at home, usually we check it in a sitting position, right? That's not very useful from a position of falls, from the point of view of falls. From the point of view of falls, you want to see what your blood pressure is as you change the position. So when you check the blood pressure at home, perhaps a better way to do it, because this topic is on falls, is to check it when you are lying, to check it when you are sitting, and to check it when you are standing in the same session, giving about 1 minute between each position, and to then detect, because as you get up, your blood pressure will drop and your heart rate will go up. This is what we call compensatory cardiovascular changes. It is completely normal. But you're looking for a drop of about 20 to 30 points. And if that happens as you change positions, that is increasing your risk of falls. And so sometimes when you go to the doctor for checkup, they will say, okay, I'll take your blood pressure when you are lying, I will take your blood pressure when you're sitting, and then I will take it when you're standing. And they will say, oh, your blood pressure dropped by 30 points. Now we have a problem, because that is saying that your postural changes are too concerning for us. It's going to cause falls. The next one is proprioception. So proprioception is your body's ability to tell your position. And it is very easy to check proprioception. All you need is one assistant, that's it. You lie down, close your eyes, and tell your assistant to move your big toe up and down, up and down, up and down, until you don't know which way they are moving it, and then to ask you, is it up or down? If they've pointed your toe up, but you feel it is pointing down, that's a positive proprioception test and tells you that your body is not knowing what your position is in relation to your 3D environment. A very easy test to do. This part, proprioception, you need one volunteer to help you. You lie down, the eyes should be closed. They should take your toe, big toe, move it up and down few times till you are not aware of which way they are moving it. And then they should ask you, now is it up or down? How many minutes? Move it for 1 minute maybe. Yeah, 1 minute till you've lost that sense of where your toe is. And then ask the volunteer, whoever it is, which way your toe is pointing. They will know because they can see, but you won't know because your eyes are closed. If they are pointing your toe up, but you think it is pointing down, then we have a problem. And that could increase your risk of falls. Depth perception. Depth perception is very easily tested as well. What you do, again, you need a volunteer. These are not things I would recommend to do by yourself. You need a volunteer to help you. But basically, you climb a stairs to about 3 stairs, okay? Come down 1 step, go up 1 step, come down 1 step, till you've lost the idea of which step you're on. Then close your eyes, and your volunteer should ask you, are you on the second step or on the third step? And if you cannot tell how high you are on the staircase, that's a problem. Measuring your calf strength. So calf strength is very easy. You stand against a wall, and you basically lift your foot. And you measure, the volunteer will measure, how far your foot lifts off the ground. And if your foot is lifting off the ground less than 1 or 2 centimeters, your calf strength is very poor, because the normal range is about 5 centimeters when you lift your foot. But don't do it like this. Do it while you're holding the wall and measure your calf strength that way. If you cannot lift your foot more than 4 or 5 centimeters, that's a problem. You do not have calf strength, and that's going to increase your risk of falls, and you should be getting some help with some kind of assistive device so that you support your leg muscles. Ankle brachial index. This is a very easy test, but again, it needs a volunteer. Everybody checks their blood pressure at home on their arm. For ankle brachial index, this is a measure of the circulation of blood in your legs. And the way to do this is to take your blood pressure in the arm and then to take it on the leg, because our leg also has a blood pressure, and then to get a ratio. And you just need the top number, the systolic number. So if that ratio of the ankle brachial index, it's very easy mathematics. We are all very good at math, right? We hojas mathematics ma first class pass badatya. So it's a small ratio, right? You take the ankle brachial index, or the blood pressure at the ankle, ratio of that to the brachial blood pressure, the blood pressure in the arm. If that number is less than 1, you have a problem. There is not enough blood flow in your legs. Again, it's an easy test to do, but it requires a volunteer to help you with. And finally, to check your legs and your feet all the time. So things that we tell the older people to do is to measure the circumference of the calf muscle at least every 3 months, and to see if that circumference of the calf muscle is going up or down. Are you losing muscle in the calf? Because these are the muscles that help you walk, the 3 or 4 muscles in the calf. Those are the muscles that help you walk. And if those muscles are getting weaker, the circumference of the calf is going to go down. So every few months, you should measure the circumference of the calf muscle to get an idea of how your legs are doing. Other things to check in the legs, check for numbness. Do you get numbness in the leg? You can check for that very easily with a paper clip. Open the paper clip and just gently apply pressure to the bottom of the feet to make sure that there is no numbness, because that will also be a correlation to falls. And then also to check the blood sugars. It's very important that we all have glucose monitors. If you're diabetic, you have it already. You have your little AccuCheck, your finger prick for the blood sugar. But even if you're not diabetic, as we get older, sugars can go up and down very erratically. And we think it only happens in diabetic patients. No, it happens to many, many senior people. They come into the hospital, we check the blood glucose, and they're hypoglycemic. Their sugar is low, and that's why they fell. Keep an eye on the blood sugars, at least once, twice a week. If you're diabetic, obviously you've been told when to check your blood sugar 2, 3 times a day with your meals. But even if you're not diabetic, after the age of 55, you should have a sugar machine, you should have a blood pressure machine, and these are things you can do yourself to see how your body is changing, what are the things happening, and are you at risk of getting falls. Aging brain exercises. Can brain aging be slowed? Yes, the answer is we can slow brain aging. Recent studies have shown that even as we age, we continue to build new neurons, right? So if we continue to keep our mind active with different things, many times you'll see that doctors, when they retire, they will pick up a new area to learn, or even nurses. they'll start translating, or they'll do some other work because they've seen so many patients who continue to learn and keep their mind active through aging brain exercises. This helps the brain aging to slow down. And of course, staying informed. This is a guy I listen to. I don't know if you guys listen to this guy. He's got a great channel on internet. Dr. Chatterjee is one of your guys, British guy, but he talks about so many important things about health and aging. And I would highly recommend that people find this guy on internet, listen to his lectures, because he covers many of the issues, benefits of exercise, walking, mental exercises to stay active and alert. Look up this guy, but there are many people like this. He's not the only one. There are many people these days that educate us about these issues. Diet and supplements, these are some important diet and supplements. Now we get it in halal form also. Collagen, which is the supporting structure of our legs and muscles. So when you look at your skin, you have the collagen. As we get older, we lose that collagen, and our skin becomes weaker, which leads to our muscles being weaker and increases the risk of falls. We talked a little bit before about proteins, magnesium, calcium, and vitamin D. These are important supplements to support our muscles and bones to reduce the risk of falls. And then, of course, exercise. Whatever exercise we can do, whatever exercise we can. People come and say, Doc, which exercise should I do? I say, don't worry about which exercise. I'm not losing weight. I say, don't worry about weight loss. Do some exercise. Even if you have these small weights, try to carry it, at least to get some movement. You know, if you can do some push-ups, some sit-ups, even at home, you can do these exercises. And we have these chair exercises we give to the elderly people in our hospitals, which they can do just simply doing these exercises with a chair. They are called chair exercises. You can find on internet many handouts about these, just to keep the body mobile. At this point, who is worried about weight loss and things like that? We're not getting married again at this point. This is only to keep ourselves active, to keep the muscles growing, to keep the movements going. You know, simple weights you can buy, simple things you can do with chairs, but all those exercises will improve the body's dynamics and prevent the falls. You can do questionnaires also. Many GPs will give you a questionnaire, and the questionnaire will ask several questions about your risk of falls. I have a couple of questionnaires, but time is running out. But when you go to the GP's office, they will often give you these questionnaires, and depending how you answer on these questionnaires, they will determine what is the risk of falls. Do I have time to show a questionnaire, or? Don't have much time. Okay, we'll pass on that. So to summarize then, you know, we talked a little bit about falls, the impact on the healthcare system, the statistics around it, how common it is. We talked about the medical investigations that are needed. We talked about the injuries that can happen. We talked about the environmental factors as well as the medical factors to be aware of, including cardiac issues, neurological issues to be aware of, and any symptoms that you're experiencing. We talked a little bit about things you can check, things you can be aware of, things to report to the doctors. And then we talked a little bit about exercise, both mental and physical exercises, and then seeing your GP for some of the questionnaires that they can administer to determine the risk of falls. And I will end here, and maybe a couple of questions. I know we're coming close to Salah. Yes.
Very important for fall. When we are walking sometimes, one of the legs actually doesn't move. I think because then we fall down. What is the reason?
Excellent, excellent question. So one of the legs, so we see patients sometimes where they say the legs gave out. The legs gave out and they fell, right? This could be caused by many, many, many things, right? So starting with the most serious things, you know, when one side of the body is weaker than the other, obviously we worry, has there been a stroke? Has there been a mini stroke? That's the first thing. The other thing is there could be neurological things other than strokes. The nerves sometimes in those legs, in the side that is giving out, the nerves can be experiencing certain problems, compression in the hip, compression in the back. So those nerves take longer to conduct into those muscles, into those legs, and you feel like your leg is giving out. If that's happening, we need to determine where the nerve is being affected, where the nerve is being compressed so we can correct it. Muscle weakness, sometimes one side of the body has stronger muscles than the other, so you'll find one side of the body will be slower because there's more muscle weakness happening on one side, and there are many reasons for that. Sometimes there can be what we call palsy. You know, when you put a nerve to sleep, Gujarati ma ke pag sui gyo, you know, when that happens, it's usually because there was pressure on one nerve. As we get older, the nerves are more susceptible to falling asleep. In the medical term is paresthesias. In Gujarati we say pag sui gyo. We are more prone to that as we get older because the nerves get weaker, the nerves are less resilient. So there are many causes for that. Some of those causes can be serious. If one side of the body is weaker than the other, my main thing to rule out is a stroke, but many other problems can cause that as well.
Any more questions?
At night. Blood pressure medication should be taken at night to reduce the impact on the body. I am on blood pressure medication for the last few months. If I take it in the morning, it makes me dizzy, so I take it at night. But here I'm messed up because of the time change, so I have been taking it in the morning. Maybe that's why I'm a little zoned out today, but I don't know. They gave me tea, so I feel better now. Take both at night. Take both at night. But try to see, because now what we have done is we have combined the two medications into one. So we have sometimes something like Twinstar, right? Which is amlodipine and candesartan. They have combined into one pill, so it can be taken together. We are trying to reduce the number of pills people take. So sometimes they are combination drugs. And we really like to avoid this polypharmacy situation. So if you're taking more than one drug, next time you're at GP for checkup, you can talk about either combination or going down on to one medication. Yes? Oh, I have email, yes. You can contact me. Is this, oh, they've taken, oh, there it is, yes. You can contact me and I can help you with any questions you might have. Yes, you can ask him. Yes. If you see the internal medicine people, I know the GPs are prescribing like what you are saying, but if you see the internal medicine people, they will recommend that you take blood pressure medications at night, all of them, unless it is twice a day. So if it is a twice a day medication, like metoprolol, for example, it's a twice a day medication, it has to be taken morning and night, so there is no way around it. But there are substitutes. So if somebody is taking metoprolol, it is usually prescribed at 12.5 or 25 twice a day, but easily that can be switched to bisoprolol, which is another beta blocker that's just once a day. And the equivalent dose would be like 2.5 or 5 milligrams, just once a day. So many medications can be switched to sister drugs that are just taken once a day, right? And that reduces the impact to the body, reduces the chance of becoming dizzy through the day or falling.
That was awesome. Thank you so much, Doctor, for this very enlightening and useful talk.
Thank you for the invitation.
And Alhamdulillah, I'm sure we would, if all of us have really benefited from this talk. If there's any further questions, I'm not sure whether the doctor will be around after.
I'll be around, yes.
Okay, so you are very welcome to ask any further questions. Thank you.
Thank you very much.
Thank you so much. Jazakallah. May Allah bless you. Alhamdulillah. Tawajjuh ziyarat, please. Assalamu alaikum ya Aba Abdullah. Assalamu alaikum ya ibna Rasulullah. Assalamu alaikum ya ibna Amir al-Mu'minin wa ibna Sayyid al-Wasiyin. Assalamu alaikum ya ibna Fatimah al-Zahra Sayyidati Nisa'il Alameen. Assalamu alaikum wa rahmatullahi wa barakatuhu. Assalamu alaikum ya Mawla ya ibna Mawla. Assalamu alaikum ya Gharib al-Ghurba. Assalamu alaikum ya Sultan ya Abul Hasan علي بن موسى الرزاق كن شفيعنا وشفيع والدينا في يوم الجزاء ورحمة الله وبركاته. السلام عليك يا صاحب الزمان. السلام عليك يا خليفة الرحمن. السلام عليك يا شريك القرآن. السلام عليك يا مولانا صاحب العصر والزمان يا ابن الزهراء عليه السلام ورحمة الله وبركاته. بسم الله الرحمن الرحيم. اللهم كن لوليك الحجة ابن الحسن صلواتك عليه وعلى آبائه في هذه الساعة وفي كل ساعة وليا وحافظا وقائدا وناصرا ودليلا وعينا حتى تسكنه أرزق توأم وتمتعه فيها طويلا برحمتك يا أرحم الراحمين. الصلوات.